And welcome to our symposium on refugees and migrants. My name is Nicholas Torres, and I serve in the capacity as Executive Director of the network TUFH. The network TUFH is an international organization that fosters equitable, community-oriented health services and education and research with the goal of improving health locally and globally. TUFH convenes innovative healthcare organizations, universities, community institutions, and thought leaders from all over the world. We host an international conference, weekly expert virtual symposiums, and a Medline Index journal, Education for Health. Our current topics of concern include social accountability, interprofessional education, population health, and community approaches to engage and serve remote and rural health, indigenous refugees, women, and elderly populations. Thank you for everyone for joining us on this important topic. We will start the symposium with a presentation by Monique J. Morrow, who's the president and co-founder of the Humanized Internet. We will then invite you, participants, to join the conversation by sharing your own expertise, and react to the material presented or ask questions. Keep in mind that this symposium is being recorded and will serve as a source of information when global thought leaders convene at the network TUFH's Global Social Solutions Challenge on September 10th to collectively design, test, and reach consensus on global recommendations resulting in policy papers. So I'd first like to welcome Monique, who will provide a little bit of background on herself and her work before launching the presentation. So Monique, would you like to introduce yourself?
Absolutely, and it's a pleasure to be here at the virtual symposium on such an important topic. My name is Monique Morrow, and I am president and co-founder of the Humanized Internet. The Humanized Internet is a Swiss-based nonprofit, which consists really of three areas of focus. One is around this whole notion of digital identity or identity sets. And embedded with that also is tech for social good. So that's one. The second area that's very important is, are you in control of your identity sets? This is a big question. You know, what does that look like, and being sort of in control? And the third area is around cybersecurity and privacy. So there's three big buckets. And a big wrapper of what we do is also around framing questions around ethics and the technology sets itself. I am also a co-chair of, I'm involved in IEEE, which is, you know, the International Electronic Engineering Group, and we're looking at this whole notion of AR in action and ethics, not to point too much of a dystopian view of the world, but it's responsible to understand the intentionality of technology itself. I will say that my co-founder is based in Toronto, and one of the members of my board is in Berlin, who happens to be a former refugee. I think if you walk in the shoes of a refugee, you understand what goes on and what happens in this whole space. So I'm really excited to be here. The other background that I must say as a technologist, I was one of Cisco Systems CTOs and Distinguished Consulting Engineers, the CTOs. And, you know, worked 16, 17 years in that space. So technology is sort of a core competency that I have. And so once again, it's all about social good. It's also about, you know, using these technologies to actually frame an opportunity of what we can do, especially with people who are so underserved, refugees, migrants, and women. So we'll go to the first slide as we commence this conversation, which I'm very, very excited about once again. And the first slide is going to pose a question. It's the title slide, basically. And this slide is really, what would you do if? And I think you see my attribution here. What would you do if? What would you do if suddenly one day you woke up and if you had to leave? Because maybe it's of war, maybe it's natural disasters or catastrophes. There are some conditions that you would have to leave. What would you do? And so one thing that I do want to say before I go to the next slide is that my colleague who's on the board with me, who you know, came to Berlin as a refugee, basically said it didn't matter that he had his documentation on a Google Drive. He just didn't have the original documents. And, you know, coming from a country or coming from institutions that have been destroyed, in this particular case, Syria, it was very, very difficult to get the original papers. So we have to think in a world that where we're in this world of the 21st century, where technology is moving very, very quickly, where we know question about what happens when your papers no longer exist, and or the organization that's giving you that accreditation no longer exists. How do you actually provide this credentialing for life? So I think to frame it, especially around the areas of displaced people, whether they are displaced by war and conflict or have been so designated as refugees. And by the way, if you look at even the Rohingya population, they in many cases don't have a status per se. You have to look at the right to work as an issue, right? So this frames it up to, being credentialed for the right to work, and they've lost their qualifications, or they've lost their attestations for their qualifications. And of course, this potential is very important because they could represent, you and I in a situation. Remember the question that I commenced with is, what would happen if? And the scenarios here are really critical because fundamentally, in the Universal Declaration of Human Rights, you do have the right to work. And so I think visiting the Universal Declaration of Human Rights is worth that opportunity to look at what it means when you are floating from one country to another, because it's not by choice, but you have that right to work, and how do you get to that right and dignity to work? So, when we frame up the discussion, this is untapped, I would say, resources for organizations to explore further. Now, here's a very important question too to ask. I posed the question again: what happens if? What happens if you don't have your identity, what I call an ID card or a passport, and you're just simply not in the system? You could imagine what that's like, or you can imagine when your paper passport is taken away from you. And this could be something which is the second most lucrative business in the world, which is human trafficking. And it's the second most lucrative business after drug trafficking. And we know that there have been, as we continue along the journey of, how do you use technologies to serve the underserved or those who have been displaced, to how do you use this technology? For example, the focus of the Humanized Internet, for example, is on the issue of digital identity or identity sets, where you could, if a paper is taken away from you, at least there's some kind of could be a triggered event where you're lost. Somebody knows that you've disappeared or something, and you're out of the system. So human trafficking, people become vulnerable. And by the way, refugees are vulnerable to this kind of scenario. They're vulnerable to the scenario not only in what you would consider countries of war, but they're vulnerable to the scenario in, quite frankly, in Europe and the United States. You could, there have been specials around what's happening in various cities in the United States, and human trafficking is hugely a big issue. So we need to, through what you would call developed, I hate to use the term developed in developing countries, but it is universal. So that's one concern that we have with vulnerable people not having digital identity, not having identity sets, not having accreditation where they are very, very exposed. I will say this, taking a pause, I had a chance to visit Jordan. It was a UNHCR hosted mission. The refugee camp, the Satari camp, as well as visit a refugee family. 80% of the refugees in Jordan live outside the camps. But I can tell you that, and with Jordan too, there's the whole polarity of unemployment. People want to work, so you have you have an influx of refugees who want to work. You have people who are Jordanians who want to work, and then you've got this polarity of how do you handle accreditation, and how do you handle this whole area of providing papers where people are very interested in being functional in society. Most of the people I met and the delegation with whom I was engaged really want to work. They don't want to be given a handout. They want to go back to their professions. And you could imagine that that's really important. We met one lady who's been in the camp, in the Zatari camp for about 5 years. She met her husband there, and they have a little baby girl, but she has a scholarship to go to a local university to become a dentist. So the aspirations are the education is very, very key. In these camps, Jordanian law applies. That means you cannot marry a girl at age 12. 18 years old is what applies here. But, girls particularly are extremely vulnerable, and meeting wonderful girls who have such aspirations in the camp through a program called the Tiger Program, as vulnerable sets of the population. They're using iPads, they're digitally savvy. When you went around the room and asked what it is you want to do, each one of them, it was doctor, lawyer, dentist. One person wants to be a helicopter pilot. It was really amazing and touching to see that. So the aspirations are very much there. Imagine if it happens to you, you're in these camps, and by the way, the duration in camps, whether it's in some of the camps in Africa, Kenya, or Uganda, you're looking at people who've been there for 10 years on an average. So I think that's a thing that people do not realize. It's not just that you show up, you're given sort of Maslow's law of blankets and basic things. People realize that they want to do stuff and they want to be flourishing in the society, and they're stuck. Most really do want to go back home, and most really, when they make a cultural decision to leave and to quote unquote be resettled, which is the language of UNHCR, meaning the receiving country receives them, they absolutely want to be. It's a hard decision because, in particularly Jordan's case, there is no return policy. So they have psychologically and emotionally spoken with one another to say, we are going to be resettled in Sweden or whatever your country, the country is. Usually it's because there are relatives there, but on the condition that they can work. And the reason why this particular topic about credentialing, especially at a professional level, digital identity, as you can see it, an inverse triangle, because it gives you, you're talking about access to basic goods, an education or healthcare, et cetera, is because the cost to recertify or re-credential, if you will, in some of these countries could range, 90,000 to 50,000, 90,000 euros, dollars plus. And so what happens is that a lot of the people end up stretching the social system, which plays out to a very, very negative political narrative. And that's what you're trying to, I think, the way to structure a program is to make sure that you look at it from end to end, such that not be the case. So if I have these papers, they have been recertified, I have been re-credentialed, the receiving country accepts them, then I can work. That's the example of what we can do, particularly. Well, one of the things that, this is empirical evidence. It was a study about the use of the mobile phone with a couple of researchers out of Germany. And the mobile phone, and this is important because the mobile phone is the sort of tool. It is a tool. Think about what is the one item that you could not live without. I remember framing that as a question in an audience, and one of the responses was, I can't live without my mobile phone. And so the mobile phone was everything for the refugees who were migrating, for the people who were migrating. At GPS, they could tell you when the ocean level or the wave levels, the temperature was gone, especially for those who end up on boats, unfortunately. But it's really was their tool. It was their tool. It took them everywhere. It was one thing they couldn't live without, even if they would hawk everything and have some kind of phone with a portable SIM, if you wanted, or a card in it. And I think this is a really important testimonial where this particular refugee stated The smartphone was my, it's my hand, my leg, and everything. It was all I need. And the implication of such a statement is because tools, as we build tools as organizations, what we find is that the mobile phone, whatever country you're in, becomes very, very important. It is the sort of where you can connect biometrically with the phone, whatever you want to do. It's whether you store digital sets of your identity, how that would look in the phone. When it is lost, an event is driven and everything sort of disappears, and maybe you have a backup drive or something backup where all the data is flowed to. But the mobile phone is very, very important. What we see now in a lot of organizations and a lot of industry is the development of tools. And I'm going to be meeting some people in a few days on the use of mobile phone in healthcare, for example, on a panel that I will actually be moderating at the World Society of Information Summit, WSIS, that is occurring this week in Geneva. So, I talked about, I sort of framed the discussion in terms of what you do, all the stuff that is gone, and maybe because of war or natural disaster, what happens when you don't have papers, how vulnerable you are, and of course human trafficking fits in. And human trafficking fits in certainly, as I said, in the refugee community. Now we're going to talk a little bit, what happens when you're not in control of your data. By the way, a lot of what I'm talking about is going to be in a forthcoming book called The Humanized Internet. And so the Humanized Internet is going to be published in about a month and a half. And this is the whole notion of digital identity and all of the content that I've been kind of talking about heretofore, and the directionality of control and digital control of your data sets. So the thing that we want to look at as we switch gears a bit is the minute you have online, this whole notion of identity and online identity is important because you have what we call digital exhaust about yourself. So on one hand, it's all about our digital identity, but on the other hand, there is the other component of it is, are you in control of your identity? And this is the question applies to you whether you are a refugee, a migrant, underserved individual in an indigenous community, and or a person who happens to be a physician in Geneva. You have to think about what that means, because what's happening is that there is a level of sort of profiling about you that you may be unaware of. This gets into the whole area of predictive analytics. I could predict that you will commit a future crime. I could predict, this gets into what we call also between the intersectionality of algorithmic decision-making and human rights. So, so the tools are extraordinarily powerful. And so when you put your online identity, when you have this persona, stuff happens where there's this whole profiling about yourself. And I think this is extremely important to be cognizant of what types of entities or what types of tools are doing that. I think there is something where we can get into behavioral analytics and sentiment analytics. There is if you look at how you express yourself online, there is a tool called applymagicsauce.com. It's from Cambridge University. The psychometric group has nothing to do with Cambridge Analytica, but it is a psychometric group, and basically you can see what the persona may come back about you. And so this is extremely important. And I mention this because when you talk with refugees, or you talk with groups of people, they use a lot of messaging. They'll use WhatsApp. They'll use a lot of Facebook. I mean, I have a colleague who's in the DRC, the Democratic Republic of Congo, and the use of these types of messaging is very, very important. But again, then you get into other areas of what kinds of exchanges of news are there, what's being said about you, or what's being said about your organization, and so on. So this is something that we talk about and quite a bit amongst ourselves in the Humanized Internet, and with colleagues who are in this particular space, I have colleagues in Procevis.ch. They're working on, this whole notion of digital identity where you sort of in control government as a service, and their nonprofit arm is the Vetri and the Vetri Foundation. And here it is that you can imagine if you wanted to sell your data, how would you have that exchange frictionless and so on. So this is an important question to ask ourselves about as we're floating through society, on a very macro level, what does that mean? And what does it mean about yourself? And what does it mean, in terms of, do you think that we should have sort of this digital declaration of human rights? Some people are actually talking about something of that nature. And if so, what would that look like? So going back to the original discussion around digital identity, if you don't have an identity, if you're not into the system, you can actually see that you're not going to be privy to certain services. Will I be privy to healthcare? Could I register, could I register my rent, have official records of registration in a community? The interesting thing is this is sort of the basis. Your identity set, and perhaps one could argue in a digital format, is sort of the basis. Now, the future I see perhaps 10 years from now will be in that one group here is self-sovereign identity. People are looking at what self-sovereign identity means, which is really you being sort of the purveyor of your own identity sets, where you can actually self-disclose what it is you want to self-disclose about yourself. But self-sovereign identity is a ways, it's kind of in the future, and people are looking at it. There is an organization to pay attention to, which is Sovereign, SOVRIN, and there's sort of a direction in the space about distributed ledger identity, self-sovereign identity becoming one of them. And I think this becomes a great focus, because if you lose your passport, if you lose that paper, can you imagine and to be in the system, what does it mean to be in the system? How could you actually register yourself in the system in a way such that it is seen by and organizations across the, globally that need to be, or you selectively do that. And I think that becomes quite, in the direction that we probably want to think about moving forward in the future. Remember how I started out the conversation. It didn't matter, if you pick up one day and you have a hurricane or an earthquake and your institutions are totally destroyed, it doesn't matter that you have copies of your documents or your marriage certificates or anything else in a digital drive. It has to be of who and what entities accept them, what entities actually provide the attestation that you have been sort of credentialed in that format. If you haven't gotten it by now, identity is core. Now, identity, I will say this, there's the cultural of who you are, you're born a certain, there's that can never be taken away from you, but it's also, there's sort of this, that which is given to you, that which is given as a gate, that which allows you to participate in communities, that which allows you to go sort of borderless, if you will, freely, and to be part of a, this whole notion of social inclusion. Now, I talked about the issue of resettlement, but the fact is, when you don't have these papers, or when their papers are taken away, because I spoke with some people who were talking about human traffic. We sat down over dinner, and he actually said, I can walk you not too far from here, and I can show you where that trafficking is occurring. The fact is, when people are trafficked, their papers are absolutely taken away. Whatever they had in a passport format is taken away. So they have nothing. And they are just vulnerable. And so, is technology going to solve that problem? Not necessarily. Technology, by the way, has no agency. But it's also about the will of organizations to work on looking at how you can mitigate and prevent such a problem from occurring in the first place, and/or looking at how we can solve for it with tools. And so that's, I don't dictate a solution. It's more of the conversations that we're having, repeated conversations, meeting with people who happen to have been victims in these conditions. So, yeah, look, technology is here. We have all kinds of these are buzzwords of technology tool sets, but certainly, when you're talking about being able to have credentialing and using these technologies, like, for example, blockchain, you give it a certificate and I can actually register, timestamp that forevermore by a credentialing organization that exists. I mean, I have my own certificate from that. I have proof of that. And by the way, if you have a hackathon, if you have a problem solving where blockchain is part of it, organizations typically like to give you a credential, a certificate that you can look and register in the blockchain that you participated, and you can forever see it by using a tool like Block Explorers. So that those tools are already in existence. And I think that's the sort of the vision. And with the Internet of Things, when you're talking about devices, when you're talking about again, as an identity, because they all have identities. By the way, devices have identities, and you can think about the amount of identities. One is around blood supply transfer, right? So, if you look at it with sensors that are sort of embedded, how do you know source, and what happens if there's something that's tainted? You can look at the temperature condition, the changes. These are the examples that people have been working on. I'm going to be meeting some people in Geneva on the panel they're doing exactly that type of thing, right? So, and they have a medical background. So the transport of supplies, the transport of something that is sensitive and has to be managed, especially with temperature changes. And of course, you can actually look at provenance from the beginning to the end of where the sources were, such that if there was a blood supply that was tainted, you would be able to find it. This goes to examples like, when you have salmonella cases or cases of E. coli, you should be able to find it immediately, because you would be monitoring the sources and the batches. Have they been registered again, in terms of provenance on blockchain. These are sort of examples that people have been looking at and doing, quite frankly, today. But I think the road is here. As I said before, self-sovereignty is probably the noble goal. But, we're probably around 10 years ahead. I mean, maybe 10 years in a time frame to circa. I hate to quote time, because as a technologist, technology is moving so quickly. But it's something to pay attention to. It's identity. It's identity in its formats. It's identity that you're choosing to be selective about yourself. It's looking at how you yourself are in control of your identity sets and what that looks like. I think those are the interesting areas to look at. We think about what can be persistent. I talked about the use of the mobile phone. We see that as a common tool that we're using. You look at what you're controlling about yourself, just as I spoke about previously, what you typically want to share and how you want to share it. You have something that is given to you, perhaps in a paper ID, and then there's digital in terms of where the issuer provides you with some kinds of credentialing attestation, and how that can live on in its immutable form. So these are sort of kind of a visual that depicts very much what we're looking at in terms of actual research and implementation. Yeah, I mean, it's not a hard problem to solve for, I do believe. We're looking at, what would a digital apostille be in its format about you, about that it's given to you in a digital form that you can pull. I think that's something that people are looking at, and I'm talking to some computer scientists about some of the hard problems that I would like to see solved, which I'll discuss in a few minutes. So I think here are some areas that we are looking at with some organizations and universities. One is, and this is where I usually have a sort of the call to action, because I'm continuing, we're looking at some studies to be formulated here. One is the persistence, digital over paper, that it's not necessarily maintained by a third party. It could be given to you, it's credentialed, it's given to you, but it's probably in some kind of digital format. And you have to look at to assure that there is not falsification of that footprint, but it's forever persistent to you. I think that's a really, really important area to look at. Credentialing and certification for immutability, that's low-hanging fruit. That's stuff we can be doing. In fact, we should be doing. And some teaching institutions are already doing that. If you get a degree, could we imagine actually posting your degree in a blockchain format, be with a timestamp, and it's forever there. You can play around with it, and such that if that institution were to disappear, you have it. It's credentialing also for working in an organization. It's not just from an institution, but I worked in an organization and I receive a credential. I mean, we have to look at how we get fluidity in the industry, and maybe that is coming from an attestation, as such that it is maybe posted and timestamped from this date to this date in a blockchain, right? And human resources can look at it and say, okay, that's interesting. I actually had a discussion quite recently on future of work, and we were looking at these types of hypotheses. They're not just hypotheses, but situations. Would an organization accept my papers or my credentialing in a digital format if I were to present them, let's say, in this notion of a blockchain, right? Or here it is, and you can look at this Explorer site, a block Explorer site. And the answer is, yeah, possibly interesting. But I think this is where we get into sort of fluidity. We want to break down the silos. We're looking at not only areas of research, but we're looking at areas of implementation, some of which is happening already. The other areas around real-time apostille, and this gets into, I think you're starting to see this a little more, border crossing notary services that are real-time. There's sort of an apostille, which is given by an organization, usually a government entity, which you can see. I think that in a digital format becomes quite interesting, especially if you've lost your papers. You lose your passport in a plane or whatever, you've got something that, you're absolutely in the system. They can see you. There's a digital apostille. You can post it. You can, there's something there. It's not just that as you board a plane, who you are, but something may happen where you've lost your documentation. So we have to look at this notion of what real-time apostille is. The one area that I'm very, very bold about is number 4. And number 4 is, I've been talking to computer scientists in this area is around this creation of a digital safe box where you and your close family members have digital keys. So if you think of the analogy of storing your papers in a safe deposit box, or maybe at your home or in a bank or in some entity, what happens if those originals get destroyed? And so we were thinking there's this area around, you could have shared devices, shared digital devices, whether they are iPads or whatever, and you will have sort of shared digital keys that are event driven. So if something happens to me, there's an event, and those keys get, if I die, there's an event, and those keys get populated or actually shared with my next close of kin or whatever. And I think that's something that's very, very interesting. You could have a backup in a central storage. There are some groups that are looking at this, but storage becomes very, very interesting. And so I've spoken to quite a few computer scientists. We're looking at this area very, very closely. It's a hard problem to solve for, but it's an interesting problem I think we can look at. And it goes back to the top of the question, what happens if it were you? So that we can think in a way that we have these tools available to us, and of course you have the wherefore to change close of fit, whoever your family members are. But digital keys are very, very interesting to look at, and of course number 5, everything has to be, is a polarity, secure and private. Goes back to, are you in control of your data, but they have to be secure. People are looking at, oh gosh, I can hack this, I can hack that. Well, technology doesn't prevent bad characters from being bad characters, but we're always looking at how we can be, looking at scenarios where there are vulnerabilities, and we are dealing with vulnerabilities every day. So these are wonderful opportunities of not only research, but also in some cases there are minimal viable products being developed. There are examples of people doing stuff in some of these areas. You know, when you don't, your name is your name, and you have to be in the center. It goes back to you know, identity. It goes back to, are you in control? And it goes back to what's very, very important. Nothing can take that away from you. But when you're not in the system, you have, you know, you're vulnerable. You have no access to the healthcare that you could, or access to education, or just the basics that we demand and that we have and take for granted in our society. So, you know, this is a call out to all of us in whatever field you have or you're in, is to think out about that question. When things happen to you, bad stuff happens to you. It's not that you don't want to wait for the bad stuff. I think what's really important is to be very, very embedded into these sets of discussions, because I think there are great possibilities. There's great work being done, and I think there's more to be done in this space, and especially if we're looking at you know, how do you deal with healthcare and vulnerable people. I think this is wonderful. So that's my call out.
Well, thank you, Monique. That was very enlightening, and you know, I think, you know, that the three things that I've heard from it is, you know, healthcare and refugee camps. You know, you said some people are in there for 10 years, so it's basically you have to have a whole health system while you're in the refugee camp, with or without the identity. The second thing that I really, you know, that resonated with me was the credentialing. So we talk a lot about credentialing, and it's like, how many of those people need the credentialing to move out so they can actually work, move to the country, and then work within the field they have. And so there's a lot of credentialing conversations, not only in re-credentialing people, but also credentialing new types of, you know, community health workers. And then the third sort of distraction is this digital safe box, as you said. And I was like, we've moved into this digital age, and saying, as I think of our own digital safe box, is like what needs to be in there. And the reality is, I don't think many of us have that. But in healthcare, is also like, how's my health history going on? So, anyways, that was just the initial reactions to that.
Yeah, I mean, so you know, so, you know, you're given. So when you register, for example, when you're in the camp, you are given you are registered in their database. They don't care if your name, you know, there may be some, there's some first set of an identity that's given to you in a refugee camp. So just to start that off. But I think what happens is that, you know, it's how we proliferate across these organizations to actually going from refugee or migrant to actually being a full contributing member of our quote unquote society. Certainly in healthcare, patient records sharing and all of that. I mean, there's this whole notion, but let's talk about, I'm working with some folks in the healthcare industry on, you know, how they, for example, how would I share my information? How is information shared amongst doctors and physicians about a particular patient? You know, and how do you deal with that? Would technology sort of be an enabler for that? And the answer is yes. There is that enabling fact of it. You know, when we get into precision medicine, and the fact that I would want to maybe share, and with precision medicine, you're talking about some level of genomics. It's how much I'm going to share, and how much I want to be in control of how is that being passed from actor to actor in the healthcare industry. So selective disclosure is very, very important here. I want to be able to not only share it because I want to know, but I also contribute to medicine. But I also want to be able to control that. You know, there's an equation which is trust equals transparency and control. And when you're no longer in control, when it's going to other actors that you're unaware of, then you have insurance groups, for example, or whatever, then you have a problem here. So, and then of course you can actually timestamp when that happens. I mean, I'm going to be talking with somebody from a pharmaceutical industry, and they want to look at the use of chatbots, you know, AI chatbots, and let's say drug trials. And so you have to look at what is the governance model in that, especially when you have to be careful around the notion of algorithms. Bots have been known to create their own language, and so you have to. So it's not, and that's a separate topic in itself. But certainly, it just becomes very, very bold in terms of what we can do in the medical field.
Great, thanks. So I'm going to turn it over to some of our participants, and we'll start with Bill Burdick, who will give either reaction or questions, or have questions for you. So Bill, you want to start and maybe give a little introduction to who you are and who you represent, so that gives everybody else the context.
Yeah. Thanks so much, Monique. Sorry, I'm on off mute now, I think.
Hey.
I think your work represents that wonderful intersection between technology and society that's often overlooked. So thank you just for being in that space. I had a panelist who asked a question, what is blockchain? I put on a very simple cartoon-like graphic that was put out by Reuters.com for other participants to look at that helped me understand it better. But one of the issues that came, first of all, I'm a VP for Education at FAMRI CFMG, and we're actually organizing a meeting with WHO in Istanbul in December that I've spoken with one of your representatives about recently. One of the thoughts is that as I spoke with our technology person about blockchain, the first reaction was sort of defensive related to cost. And so you mentioned the will of organizations to change. Can you speak a little bit about the financial cost to credential agencies to implement and use blockchain technology? And I recognize that it's not fair just to talk about costs without talking about benefits, but understanding costs, I think, is a first step.
Right. So let's go back to, do we have a common understanding of blockchain, right? I think the one visual that I love that was wonderfully explained is think about a bunch of pieces of glass. When you put them together, you have a single source of truth, right? So it's an append-only technology, and one of the nice things about it is you can actually see this. There is this transparency. You can actually see transactions. We'll call them transactions. You can actually look at it, and it's pseudonymous at best. Now, you don't put everything on a blockchain. That's important to note because it is going to be forever and ever there. Now, when we look at cost, typically what people think about cost is they think about some of the consensus mechanisms like proof of work, and they say, oh my God, it's taking so much energy and more energy than Iceland. And these are sort of the arguments of just to state that there are other technologies that are actually going to eliminate or alleviate that problem. In fact, if you get into if you get into a group where we're a consortium, that's not really an issue anymore. So when you talk about credentialing, I mean, look, my counter response is what happens when you don't credential. Okay, so think about this problem where if I'm a refugee and I have been given papers or I haven't been given papers, but I'm resettled and I have to borrow 90,000. This is a discussion I had in Melbourne, Australia. And I have to borrow 90,000 to 100,000 US dollars to recertify. You know what they do? They drive taxis, or they do other things, or they weigh onto the social system. And so, which is not what they want to do. So the credentialing, I mean, it's already happening. So I don't think that's the low-hanging fruit that I've been looking at and exploring. And I have proof because, I just graduated, I just did I believe in education is lifelong. So I have my certificate and a degree that is forever on the blockchain. That didn't cost them anything. Didn't cost the organization much to do that, right? So where you're going to, I think, is more in the sense of what is the knowledge that an organization has to have in the credentialing exercise, in the process, especially when dealing with these sets of technologies. And I think where we need to go is more on we need to look at the standardization process here, and we're not really standardized yet in that direction. I think that's really an opportunity. You see some of the implementations and experiments, and in some cases full products, but I think as we rally around the industry, we have a chance to do that from a standardized perspective. Governance is about 20% there.
Arisha, anything you'd like to add?
Hi. Yes, thank you, Monique. I just wanted to thank you. It was a very good presentation. Living in Belgium, the refugee crisis within Europe is well known and spread out across different countries, and it's a hot topic. Let's say we have a lot of people in crisis, and the countries within Europe are all responding on a different way. I just wondered how you would go about the identity that you're talking about of creating it to make it something universally known, internationally acceptable, because as you were saying, it could be anyone. I could have a global crisis happen here in Belgium and then have to go out to make it something that if I have it, that it would be known at the border that I'm going to cross. Any techniques on that?
Yeah, I mean, I got to be careful because I'm not talking about world citizenship, because sometimes it has the allure. I'm talking about world citizenship. And by the way, I'll take just a step back on identity. If you take a look at Sovereign, SOVRIN, UNHCR, the Digital Identity Group, just actually issued an RFP on digital identity for refugees, and Sovereign is very much embedded in that RFP. So, you know, that's a step forward, and that gets a step forward to quote unquote standardization. I just wanted to take that question further. Look, I think what happens is that we need to think about, you know, how do we handle it in our own countries, and how do we make sure it's transferable and sort of portable in that sense, because of, to the point I said before, these the digital, I mean, things do happen. There have been questions as whether or not we take it at the UN level, but again, that's a tough one, because now you have organizations that may push back on the discussion, or maybe not. Well, I mean, that gets into how do you frame it from a political perspective. I give you a certain level of citizenship or something. That is something that you do have. People had citizenship, you know, and again, going back to Rohingyas, that's a different situation, but you're given something. But we have to make it digitally sort of at the very, very, very fundamental transferable, because things do happen. So you're in Brussels, you're at the EU. I'm sure you're looking at the H2020 projects that are happening in this area. Anything that's dealing with blockchain, EU identity is becoming very, very key topic. I think there are questions now. Countries are struggling about, well, what does e-identity look like? The closest that you had was probably Estonia, to that sense, although smaller. But Estonia is quite an interesting example, because not only and I have an Estonian identity card, or EID card, if you will, but in sense of if something were to happen, their data is mirrored in other embassies. So if they had an invasion, nobody would get a hold of the citizen data. So I mean, so we do have poignant examples. I mean, I think you know, just taking what has happened in Estonia, and by the way, what happens in Estonia in terms of how they deal with healthcare is very, very interesting too. You know, everything has to be sort of a digital prescription, and you actually get a little more fined if it's not, and so on and so forth. So it's not like we're starting out with you know, a green field. But I think it's situations, as you said, stuff can happen to you. You wake up one day, and by the way, you wake up one day and you have a catastrophic earthquake in Italy. Or you have a catastrophic earthquake. I lived in California, and or we'll look at what happened in Puerto Rico. These are the types of things that we need to think about. You have to be part of that solution. Get involved.
Jacques, would you like to explain, go next, and just give us an introduction to yourself briefly, and what organization or you may represent?
Yes. Hello, everyone. I'm Monique. It's a wonderful presentation.
Thank you.
I'm the director of global health at Laval University in Quebec City, Canada. But actually, I was really very, very impressed by this whole concern about health refugees workforce, and I think that this concern is really, really important, and probably the way you were explaining to us, like part of the solutions, just to make sure that they become more visible. In fact, this is the whole issue, and that we could actually have them reintegrate actually for this all important issue of healthcare. But I have it's more a question in terms of the ownership of this blockchain. I'm not. Maybe there is something that is escaping to me, but how we could deal with this ownership thing, because of course this is usually what technology is all about. How we could actually have the technology serve human beings, serve the society, instead of having this, I would say, invisible hand, as we say it, taking over. You see what I mean? So could you reassure us in terms of how we could handle this overall issue of ownership of the blockchain, and how do we deal with this?
Yeah, that's a great question, and I visited your wonderful university years ago in Quebec. So great university. Well, first of all, who owns the internet? Now, I say that because now some people will say there are a few companies now starting to centralize control, but the analogy is that ownership is if we look at the public blockchain, it's sort of this, that is the analogy. It's nobody owns it per se. That's sort of the direction. Although you'll have pieces, I could imagine, of centralization or hybrided. I'll call it hybrided. And that gets into something where you're in a consortium and it's permissioned and you trade, you're exchanging data amongst each other because you're known. It's been characterized as trustless trust. But the analogy is that nobody really owns the public blockchain. Nobody really owns it per se. I mean, you could get into a lot of discussions around mining. We're not into the cryptocurrency space. We're not into that. It's more about, how do you actually assure that there is some level of immutability, and that's the direction to be sort of taken. And I think that the thing that when we look at the history here, the history is that there was a paper published. It was 2009, and Satoshi Nakamoto, he, she, they, what, built on years of work, not just that 2009 paper, that does get into a peer-to-peer system of exchange, distributed exchange of value, but it was just after the financial crisis, where trust was completely broken. And still we have never gotten out of it. And so there are principles that people so that organizations adhere to. I'll just put it at the very macro level. In the end, nobody really owns it, but I think we can put much more governance to it. I do agree. There's a great amount of work to be done in looking at how we standardize areas of it. But I think it's great if I would see Laval University come out and do something in that space and say, okay, for this particular group of nurses or practitioners, we're going to, we're going to have a credentialing system. We're going to use, blocks. We can decide what that is. I mean, what that can look like. You can look at look at sovereign as an example. Lots of organizations are going towards sovereign, and sort of experiment a bit in that area. MIT has been doing it, Princeton University. So universities are actually the ones gravitating in the space, because I think they want to be able to look at how they can provide credentialing in a new way, a new fashion, and such that it, if they don't exist, there is proof of that the credentialing university gave it to them, gave me a certificate and so on. If that makes sense to you. Thank you. I do see a question. I'm not going to call it the person, but I think there was a question about companies who handle massive data, like the FANGs of the world, called Facebook, Google. There is that's a fair question to call out. And this is the whole issue around control or non-control. There's a great book to read. Actually, I'll show you. I'm a Luddite. I like books. But here's my book. It's big. It's thick. It's called The Age of Surveillance Capitalism. And it's by Shoshana Zuboff. And it's many, many years of her research in this area. And she does talk about some of the questions that were asked about control and scandals and by some of, and how you are profiled and so on. So it's worth a read as a background, as your homework.
And for one last question that the Moira posted before, is going back to these credentialing list standards. is, you know, the cost of credentialing or re-credentialing is there's credentialing agencies out there. But do you think that's shifting through blockchain, or is there, or are there new entities coming up to do alternative type of credentialing, especially like in healthcare, where we talk about credentialing community health workers, and there's not a standard for them yet. So the question is like, how do you get them that credential so they can participate in the workforce?
I think credentialing agencies can use this technology. It's not to replace credentialing agencies per se. I want to make that categorically clear. I think it's just more about when you, the thing of it is that you have to look at sustainability of what it is you're being credentialed with. You know, and so if I can have something that is totally there, it's immutable, and we see that it's immutable when you go and say, look, I want the transcripts of your university. Look at how you apply for a degree or whatever. Well, you know, you can have proof of that already in sort of a digital format, and that could come in the form of a timestamp credential, and it's forever there. And I think that that's something that we could start thinking about per se. And credentialing agencies have an opportunity to adopt these sets of technologies if they want.
Well, thank you, Monique Monroe. Again, Monique Monroe is the president and co-founder of the Humanized Internet. Thank you for your time. We really appreciate this, and you know, we'll be sure to share this video with our knowledge, you know, our knowledge base. But we appreciate your time, and you know, especially educating us sort of on this different aspect of how it's going to be affecting healthcare globally. Thank you.
Well, it's been a pleasure, and healthcare is so important. So I'm more than thrilled to have presented to you all today. Thank you.